Hi all, in today class we are going to discuss the vagus nerve stimulation, that is the continuation of the last class. I think in last class we discussed the first two classification, one is ECT and the another one is RTMS. In this class we are going to focus on the next classification, that is the vagus nerve stimulation. So the vagus nerve is the one important nerve in the central and peripheral nervous system that is mainly responsible for all sort of communications and also the movement control of our body. Okay, so by stimulating, okay, through this nerve we can achieve some mental treatment. Okay, so we can overcome some mental related problems. That is the main aim of bringing this particular vagus nerve stimulation. So but the main difference between the first two classification and this type of stimulation is that this type is non-invasive method. Here we have to perform some sort of surgical surgery, like we have to go with some surgical procedure to have this type of stimulation, whereas in ACT and RTMS is everything is the non-invasive type. The whole setup will be placing outside of your head. So in vagus nerve, since it is a non-invasive method, here there is a need of performing surgical procedure, so which involves a device which is being implemented under the skin. Okay, so at the other end, okay, the device is implemented under the skin and the electrodes which is connected to the brain. So by through the path it takes through the vagus nerve path. Okay, so that is the main thing here. Like the device sends an electric pulse through the left vagus nerve that actually runs from the brain stem through the neck and downside of the chest and abdomen. Okay, so here see, this is the diagram here I have given. So the electrode is being connected to the brain through the vagus nerve. It's been inserted, and then the pulse generator, that is the main device which is being giving pulse to the targeted area in order to stimulate. That pulse generator we will be placing under the skin, that is near the chest. Okay, so on the lead wires which is all the way running out through this vagus nerve, and it will reach the electrodes. That electrode is making contact to the brain where we want to trigger. So this is the whole setup here. In this way we have to place the vagus nerve stimulation method. Okay, the main aim of this vagus nerve stimulation is that to treat a particular treatment is called epilepsy. You know what is mean by epilepsy? So epilepsy is like one kind of seizure, or we can also see fits. So in certain case that there won't be any control method, there is no any other method to control this type of epilepsy in this sense, then we have to go with vagus nerve stimulation. Initially they will not go straight away to vagus nerve stimulation, since it is the invasive method. First they will try with some sort of giving medicine or doing some outside, that is invasive type stimulation method. If it is failed to recover in this method, then they will go with the vagus nerve stimulation. Okay, so that is the main thing. The main application of this type is that to treat the epilepsy. So there are things, again, since it's been a surgical method, directly we are making the connection with that brain. It's not that easy to go with this type of simulation treatment. We have certain condition we have to be met before going to this condition, as far as guidelines given by FDA. So the first condition is that the patient should be 18 years or old, and the depression has to be last at least 2 to 4 years, and the depression is very severe and recurrent, and depression has not easier after trying at least 4 other treatments. Okay, so as I said before, we can't go this particular treatment just right away, because this is something, it's very crucial, very complicated kind of treatment. Okay, so in this condition, the whatever I discussed, the 4 set of condition has to be met before going into this particular treatment. So next we will see what is the procedure we have to go with, how does it actually works. So the device is like this is the most traditional method. Also we will do with the surgical procedure. The pulse generator we will placed on upper left side of the chest while the patient is under the anesthesia. The anesthesia is very important, since if we are involving we are doing surgical method, surgical procedure, the anesthesia we have to be administered to the people. and then we have to place that packet size device, okay, that under the skin, that is actually which is nothing but pulse generator. That pulse generator is after then connected to the electrical lead wire. These lead wire will travel all the way to the to the nervous nerve, left vagus nerve to the brain. Okay, so typically 30-second electrical impulse or which is being fixed or centered each and every 5 minutes from the generator to the vagus nerve. Then the duration and frequency of the pulse will also be will also be adjustable. We can also change depending upon how the generator is being programmed. And once the vagus nerve is turned on, once it gets turned on through the nervous nerve, all type the electrical signal whatever we fixed, it's been delivered to the targeted sites in order to stimulate the particular signal. So this other procedure is been following during the treatment or during the during the treatment of vagus nerve stimulation. So I think now you might compare the familiarity between a cardiac pacemaker and a vagus nerve stimulation is almost same. So what are the things we discussed in cardiac pacemaker, the same thing here we are using, that is the vagus nerve stimulation. Here also we are having some sort of generator, pulse generator that we place under this skin, that is near left side of heart, that is left side of your body, upper side, upper chest. Okay, and then other end is being connected to directly making connection with your brain. So this is almost which is similar to the cardiac pacemaker, so you can take the example for that also. So again the side effects, here also side effect also one of the things we will face when we doing this particular treatment. So obviously there will be some complication will be there, since we are doing what surgical procedure. So we have to be very careful when you are choosing power supply, because you are going to implement inside the body, and the people may lose some kind of consciousness, that is the memory loss will also be occur. There will be some chance of getting infections, and the people may feel some or experience some sort of pain, because we are implanting some electronic device inside the body. And also the people will feel some kind of discomfort or tingling sensation in the area where the device is implanted, and voice changes, and the cough or sore throat and neck pain, because we are taking the track of your neck from your to make the connection between the pulse generator to the brain. So here because that is the area the vagus nerve is we are concentrating. So since we are concentrating this particular neck area, the people will have some kind of neck pain also, even the headaches. In some cases, the people will be more conscious that they are carrying some sort of devices, so that itself it will disturb their mental problems. They feel so depressed, so uncomfort, so that even that may leads to some kind of breathing problems. They feel like more unrestlessness. So this is the some sort of side effects you can see on vagus nerve stimulation. This is all about overall what is mean by vagus nerve stimulation. So in next class we will have the continuation, that is the last type of brain stimulation treatment. Thank you.